Last month was a completely different story, right? And this month is a much worse story.
Just a month ago, there were around 100 coronavirus patients hospitalized county-wide, and that's been steadily increasing, now topping out to just over 500 San Diegans.
The vast supermajority are unvaccinated.
Scott Evans is CEO of Sharp Grossmont Hospital, which is caring for around 65 coronavirus patients. It's a far cry from the winter surge where the hospital had around 180 patients, but overall numbers are not trending in the right direction.
We're really worried about the winter. We're always extremely busy in the winter, and it feels like the winter in August in terms of our census and our number of patients. And so if we do not get some reprieve in terms of really limiting those number of COVID exposures and COVID hospitalizations, then we do fear that the winter will be very difficult.
Hospital staff are also feeling the increase.
In the beginning, we had a shortage of PPE or N95s or, isolation gowns or gloves. And now I'm kind of worried we're on a shortage of resilience.
Andrea Muir is a registered nurse at Sharp Memorial Hospital and is also a union rep for more than 5,000 Sharp healthcare workers.
They're tired. It's not only physically demanding and mentally demanding to take care of these COVID patients, along with the other patients that we are normally taking care of.
Muir is asking for the public's help to reduce the burden on the hospital system.
Make sure that we have sufficient staff to take care of people that need us. And the way that you do that is by doing your part. And if all you can do for this pandemic is making sure you're distancing and masking and getting vaccinated if you possibly can, then that's what you need to do. Because we can't do our job if there are not enough of us.
She says one of the toughest parts about her job is trying to help patients that don't believe the virus is real and are resisting care, even as they fight for their lives.
When people need to be in the hospital for this, it's because if they went home, they wouldn't survive. It's not that, it's better if you go in the hospital. They need the care.
Current hospitalizations are about a third of what they were during the winter surge, but with the widespread availability of vaccines, health officials say many of them are preventable. Matt Hoffman, KPBS News.